Hello everyone, in the series of Must Know MCQs, this time we are covering cardiac murmur. Yes, there are so many questions on cardiac murmur. Start from basic to clinical history based question. Yes, myself Dr Sanjay Khatri, we are here for our class cardiac murmur. Yes, first I will make you this point that NEET PG free test calendar. You should note this. Yes, date you should note and choose test as your convenience. But this thing I want to stress. NEET PG 2022 All India mock test. Yes, note down the date. 27th March at 9 am. You need to enroll in this test. You can use my code Dr Sanjay live to enroll in the test, but you should note down the date. Yes, Unacademy coming with the previous year questions. Bang, that test. Yes, some questions are repeated definitely from the previous year. If you make the paper randomly, those questions are selected by some very good respected examiners and they bound to repeat because they are the key question. So yes, Unacademy coming with all the previous year question in a single batch to be discussed by top faculties. Yes, so please wait for this previous year question bank from March 23rd. Yes, this batch is coming. Now something about final prof 1. Next pattern, you find clinical integrated questions with the basic subjects. So why not we start our journey from the beginning. So yes, just concentrate on MBBS prof 1 batch. Yes, educator will guide you how to write the answer, how to get the clinical integrated things together, what are the important anatomical landmark will help you in ortho and surgeries, clinical questions. This is the purpose of this batch. Start integrated study from the beginning. Now this is the batch with the top demand of the students. Yes, Unacademy coming with this batch. Doubt clarification series. You have covered the subject like any subject and you have some doubt may be your questions, maybe your topic, maybe your study hours. So educator will not teach you any topic, they come blank in the class and interaction start when you are asking the doubt. You have a doubt of questions, put the question. Okay, if doubt how many hours I need to cover this topic, that topic. So that's the doubt clarification series plus platform only 6th April onwards. So you have a chance to interact with top educator. Just clear your doubt, questions, prepare, finish your subjects, come with all the doubt in the class and we will try to answer most of them. Yes, so doubt clarification series from 6th April onward. If you are on Unacademy Plus subscription, you can access live and recorded classes both, learn from India's top educator, compete in live test and quizzes, study on the device of your choice and you can access 25,000 question bank. Now, if you can take Unacademy as a plus, if you want to take with Prep Ladder, for that there is a iconic subscription. These are the list of FMG topper. You may be next list for NEET PG 2022 toppers. Special class feature, as you all know. Good evening. Yeah, I will answer. Don't worry. Special class feature, they are very interactive. These are the courses you can target and these are the subscription. You can take plus subscription, you can take iconic subscription or you can take light subscription only for test. Yes, more than 4050 test paper to assess subject wide, mixed test, grand test. Go for your choice. But once you decided that I will go for this batch, don't forget to use code Dr Sanjay live to get additional discount. Clear? So we start. It's not seizure disorder, it's murmur, cardiac murmur class. So here is the first question. Very basic. Don't worry. I start with basic. and teach you some key point of the murmur. So concentrate, try to answer this question. Good evening Arpita, Pulraj, Soumya, Komal. Try to answer this question. Murmur trace present in the following indicate what? Indicate what? Komal is answering B. Let's see. So see, this is S1, S2, S1, S1, S2, S1, S1, S2, S1. Don't worry, I start with simple thing. Try to make the concept. If murmur is between S1 and S2, it has to be systolic murmur. If murmur is between S2 and S1, it has to be diastolic murmur. But if murmur start in systole, overlap the second heart sound, spill into diastole, then it is continuous murmur. So what are the causes of systolic murmur? Murmur is systolic. So systolic murmur you have in VSD, MR, TR, AS, PS, HOCM. These all are the causes of systolic murmur. Systolic murmur. Now come to our question. You find murmur between, in this question, you notice murmur between S1 and S2. So it has to be systolic murmur. Now see, can it be pansystolic murmur? What is pansystolic? Murmur start from S1 and overlap the S2. Pansystolic murmur causes are VSD, MR, TR. But this murmur is not pansystolic. Yeah, it start after a gap from S1. There is a gap. It start not with S1. Pansystolic murmur start with S1. Start with S1. But here you find a gap between murmur and S1. So it can't be pansystolic murmur. Yeah, it's a systolic murmur, but it can't be pansystolic murmur. So it can't be MR, it can't be VSD, and MS murmur is diastolic murmur. So it can't be mitral stenosis murmur. So yeah, it's a systolic murmur, but it is crescendo, decrescendo. Crescendo, decrescendo. Yes, it is ejection systolic murmur, which is present in aortic stenosis and pulmonary stenosis. How you define? Murmur start after a gap from S1. Murmur start, you can hear S1, then murmur start. It first ascend, then descend. Crescendo, decrescendo, and end before second heart sound. Ejection systolic murmur. Can anybody put in the comment box what this gap is? Murmur start after a gap from S1. What this gap is known as? This is isovolumetric contraction. Isovolumetric contraction. As ventricle begin to contract, aortic wall is closed, mitral is closed. So ventricle contract against two closed wall, isovolumetric contraction. After few times, aortic wall open and blood rushes to aortic wall. If it's stenosed, it produces a murmur. So ejection systolic murmur start after a gap from S1. This point will help you when you put a stethoscope here. Whoosh, whoosh, whoosh. How can you differentiate whether it's a VSD or it's a PS or it's AS? Even nursing staff tell you, sir, murmur is there, but you need to find out which murmur is there. So concentrate on S1, S2 and S1. If murmur is between S1 and S2, it is systolic. Now, if you are able to hear clear S1, then it can't be pansystolic. Okay, pansystolic murmur start with S1, overlap S2. But ejection systolic, you find a S1, then click, then crescendo, decrescendo murmur, and clearly it end before S2. So nowadays image based questions are coming. So you can identify this is crescendo, decrescendo, crescendo, decrescendo murmur of aortic stenosis, aortic stenosis. So answer is aortic stenosis. Same question, same. If I find something murmur here, so answer will be, because murmur in diastole, it has to be mitral stenosis. Simple. If you know the concept, type of murmur, it is very easy for you. It's beginning, my friend. So many questions will come. Answer this question. Answer this question. I will wait in comment box. All of the following causes continuous murmur except. This question asked 3 times, 2 times in AIMS, 1 time in NEET PG. Can you believe such a common question it is? So you need to remember causes of continuous murmur. Ayush is putting C. Okay, any other person want to answer? So what is continuous murmur? We start with basic. S1, S2, S1. Murmur is start in systole, overlap the second heart sound, spill into diastole. So yeah, this is continuous murmur. So first I come to the choice C. See, this is S1, this is S2, this is S1. So if somebody will tell you mark the VSD murmur, so this is the VSD pansystolic murmur. Same patient will have AR also. So mark the AR murmur. So this is the AR murmur. VSD plus AR can occur in the same patient. So can we call VSD AR murmur as a continuous murmur? It start in systole, overlap the second heart sound, spill into diastole. Certainly not. Why not? Because continuous murmur, complete definition, murmur start in systole, overlap the second heart sound, spill into diastole, and maintain the same character like PDA murmur. Whoosh, whoosh, whoosh. Character is not changing, but VSD AR murmur character change. First part is systolic, second part is diastolic. You can feel character is changing. So VSD AR murmur is not the example of continuous murmur, my friend. And this question asked 3 times. Venous hum, RSOV, yes, these causes you need to remember. These all are the causes of continuous murmur. See here. So what are the causes of continuous murmur? I will explain you, Ayush, because AR murmur is a diastolic murmur, na? So diastolic and systolic, it is early diastolic, it end here, it end. So yes, character change, na? But PDA murmur like a machinery murmur, same throughout systole and diastole, but here character change, na? Continuous murmur, PDA, remember, slowly and slowly, remember these causes of continuous murmur. Rupture of sinus of Valsalva, RSOV, rupture of sinus of Valsalva, any systemic AV fistula, fistula between artery and vein, collaterals, large collateral produce continuous murmur, aortopulmonary window, connection between aorta and pulmonary, if it's small, it's produce continuous murmur, Blalock Tushing shunt known as BT shunt done in the patient of TOF physiology. Yes, it is a cause of continuous murmur. And last, most confusing, is venous hum. This is the channel produced by anomalous pulmonary veins when they drain into innominate, not in the LA. So venous hum present in TAPVC. So yes, Both options are given in previous question. Yes. So PDA, we all know it's example of continuous murmur. Rupture of sinus of valsalva is a continuous murmur. Venous hum is also an example of continuous murmur. But VSD AR murmur is not an example of continuous murmur. This question, why this question come wrong? Everybody know PDA has continuous murmur. But most of, if you are not read in depth, not heard venous hum has a continuous murmur, RSOV has continuous murmur. So finish this story here. Remember all the causes of continuous murmur. PDA, rupture of sinus of valsalva, systemic AV fistula, collateral, AP window, BT shunt and venous hum. These are the causes of continuous murmur. VSD AR, MS MR, these are not the example of continuous murmur. Answer this question. No, Arpita, coarctation of aorta will have continuous murmur due to collaterals. And I mentioned collateral continuous murmur. Collateral is the cause of continuous murmur. Collateral present in coarctation of aorta and sometime in pulmonary atresia. So continuous murmur is not due to quark segment. The continuous murmur in coarctation of aorta is due to collaterals. Which of the following is systolic murmur? So you should know astinfluent murmur present in aortic regurgitation. Carriacou murmur present in rheumatic valvulitis. Still murmur, it's a functional murmur. Present in a normal thin build child, anemia, pregnancy, thyrotoxicosis, any condition, we high cardiac output, soft murmur is there, systolic murmur, still murmur. So Gibson murmur is the example of continuous murmur. It is murmur present in PDA. So our question, which of the following is systolic murmur? So you should be familiar with this terminology. Yes, there are so many questions. Systolic murmur, still murmur. Like this. Answer this question. Now you can answer. Which of the following is continuous murmur? Answer. I have told you just now. Astinfluent is a diastolic murmur. Gram steel, again diastolic. Gibson is a continuous. Doc is again diastolic. So which of the following is continuous murmur? Gibson murmur. Now, why not we revise all the murmur in a single go, which are pronounced with the name? So here these are. Now see here. One by one. Astinfluent murmur present in aortic regurgitation and it's a diastolic murmur. Roger murmur present in VSD and it is pan-systolic murmur. Means systolic murmur. Carriacou murmur present in rheumatic fever valvulitis and again it's a diastolic murmur. Slowly, Doc's murmur. I am waiting in the comment box. Present in, yes, Ayush, Vignesh, Amna, Komal. Doc's murmur present in D for doc. LAD, stenosis. Very good. Ayush, you can very well not need to write whole name. You can very well write LAD. LAD is stenosis. Again, it's a diastolic murmur. Gibson murmur present in PDA and it is continuous murmur. It is continuous murmur. Gram steel murmur. Gram steel. PR plus PAH. I mean to say gram steel murmur present in hypertensive PR. Hypertensive PR. Yes, PR, and it is again a diastolic murmur. Still murmur, functional murmur with no organic heart disease, just functional, high cardiac output, maybe normal in children, sometime due to anemia, fever. Still murmur, it is systolic murmur. Yes, sometimes we see the patient, a good pediatrician who auscultate very well, detect some soft sound. Nobody want to take risk. They send the patient to us for echo. I heard some soft sound. Yes, murmur is there. It's murmur, but no organic problem is there. Child is anemic, maybe anxious, maybe fever. Flow murmur, functional murmur, still murmur is a systolic murmur. Now, rightedness murmur, I am waiting in the comment box. If you type once with your hand now, you will never forget. Rightedness murmur present in. Rightedness murmur present in. I stop for 15 seconds. You think, pronounce this name again and again, so it will remain in your brain. Rightedness murmur present in. Anybody? In complete heart block. And again, it's a diastolic murmur. Now, this block, very good Ayush. So, this you all remember. See na, this type of question, which of the following is continuous murmur? So, it should come in a fraction of second. Continuous murmur, Gibson murmur. Which of the following is systolic murmur? Still murmur, systolic murmur. It should come in a single go. Yes, systolic, diastolic, all the name. It will take 1 minute. Trust me, 1 minute. Astinfluent, AR. Roser, VSD. Caricom, rheumatic valvulitis. Dox, LAD stenosis. Gibson, PDA. Gram steel, hold on. Gram steel, PR, PH. Gram steel, PR, PH. Still murmur, functional murmur. And rightedness murmur, complete heart block. 1 minute. Please, please, please finish it off today. These are the murmur with the names, and you find question. Now answer this question. I will wait 30 seconds. Answer this question. Mitral regurgitation murmur, increase in all except. Increase in all except. Mitral regurgitation murmur, increase in all except. I will come one by one. So first we take hand grip exercise and phenylephrine. Phenylephrine is a alpha agonist. Phenylephrine is alpha agonist. It causes vasoconstriction. Clear? So see, if vasoconstriction occur in aorta or its branches, vasoconstriction occur here. So what happen? Ultimately regurgitation will increase. So phenylephrine increases the MR murmur. The same thing happen with hand grip exercise. If you do the hand grip exercise like this, pressure increase here. pressure increase here, pressure increase here. So ultimately what happen? MR will increase. So hand grip exercise also increase MR murmur. Squatting, if you squat, femoral artery compress. Now imagine if this femoral artery compresses, femoral artery compress, same principle, pressure here increase, pressure increase, pressure increase, pressure increase, pressure increase, MR will increase, MR will increase. So squatting also increase MR murmur. So yes, squatting, phenylephrine and hand grip exercise, all these three increase MR murmur because all three increase systemic vascular resistance. Am I clear? Yes or no? All three increase systemic vascular resistance. All three will increase systemic vascular resistance. So they will increase the murmur of MR. What about inspiration? So remember, spelling of right, R-I-G-H-T, spelling of left, L-E-F-T. Right sided lesions. What are the right sided lesions? PS, PR, TS, TR. What is left sided lesions? AS, AR, MS, MR. Clear? Clear? Now see. Right sided lesions, murmur increase during inspiration. Left sided murmur increase during expiration. Very simple. Write the spelling of right, R-I. So right sided lesions murmur increase during inspiration. Spelling of left, L-E, expiration. Left sided lesions murmur increase during expiration. So mitral regurgitation increase during inspiration, not, it increase during expiration. Clear? Give thumbs up if this is clear to you. Squatting, phenylephrine and hand grip exercise increase systemic vascular resistance. So MR murmur increases. MR murmur increases. But inspiration decrease MR murmur. Expiration increase MR murmur. So yes, RIGHT, right sided lesions murmur increase during inspiration. Left sided lesions murmur increase during expiration. Am I clear? Which? Ayush, see. Suppose I give you one example. Right sided lesions, TS, TR, PS, PR. If we take inspiration, negative intrathoracic pressure, more blood comes to the right side of the heart. So more blood comes, then more blood passes through tricuspid wall and pulmonary wall. So all right sided lesions murmur increase during inspiration. Ayush, clear? Now you tell me, what the sign name? Right sided lesions murmur, TR murmur increase during inspiration. What is the name of this sign? I am waiting for answer. TR murmur increase during inspiration. What is the name of this sign? Something from C. Anybody? Right, TR murmur increase during inspiration. This is known as Carvalho sign. No, it's not Kussmaul. Kussmaul is something different. We will discuss some other days. This is Carvalho sign. Sharmana Kumar Yadav. Yes, at least you tried, na? Carvalho sign. This is Carvalho sign. TR murmur increase during inspiration. Carvalho. Yes, Arpita. Clear? If clear, na, then apply your blade. Do some application. I am expecting correct answer in this. I am holding for 30 seconds. Which of the following is incorrect? Take one by one. TR murmur, sorry. TR murmur increase with inspiration. This is right. Yes, right sided murmur increase during inspiration. This is right. MR murmur increase with hand grip exercise. Why? Because hand grip exercise increase systemic vascular resistance. When systemic vascular resistance is more, the regurgitation automatically increase. So B is right. Now C, AR murmur increase with amyl nitrate. Amyl nitrate. See, this is four chamber. Now this is aorta. Now here supposed to occur AR. If AR is there, this is AR. Now it's very clear to you. AR murmur will increase. This will increase if something increase SVR, like hand grip, squatting, phenylephrine will increase SVR, will increase regurgitation. But if something decrease SVR, systemic vascular resistance decrease in amyl nitrate, which relax the peripheral vessels. When pressure here decreases, it relax. So AR will also decrease. So amyl nitrate, AR murmur increase with amyl nitrate. This is wrong. This is wrong. Am I clear in this? Yeah, Ayush is very right. Amyl nitrate will reduce afterload. Reduce afterload means reduce systemic vascular resistance. So as murmur is also reduced. Am I clear? VSD murmur increase with squatting. See here, if there is VSD, blood from here goes to here. Now Squatting increases systemic vascular resistance. Pressure increase, more pressure on the left side. So definitely more shunt will occur. So VSD murmur will increase with squatting. Yeah, very good, Ayush. You are good in typing, actually, writing the everything. So yeah, this is known as dynamic auscultation. In one of my class, I taught previously, long back, dynamic auscultation. Yes, the questions are like this. These are very typical question. MR murmur increase in all of the following except you should know the concept. MR murmur, if anything which increase SVR will increase MR murmur. SVR, which increase SVR is squatting, hand grip exercise, phenylephrine. These all increases SVR, increase MR murmur. MR murmur not increase with inspiration. MR murmur increase with expiration. Clear? Clear? Now answer this question. Very basic question. Try to answer this question. Answer. I am waiting because I want to teach you some concept here. Mitral murmur is pansystolic. It is right. best heard at apex. This is also right. Last 2 year clinical medicine, COVID, we are afraid to touch the patient. Auscultation, yes. In our first, second, third MBBS, final MBBS, when we have a stat, the most charming thing to heard a murmur or a bronchial breathing. So yes, murmur best heard in left lateral position. We make the patient turn left side, lateral position, and heard the murmur. Yes, A, C and D all are correct. What is pitch? Frequency of the murmur. So MR is a low pitch or high pitch. Now this is the four chamber. This is MR murmur. So MR murmur is between LV and LA. LV pressure more than 10 years of age. LV pressure in adult, it's 120 and LA pressure is 10. So MR murmur is between very high pressure to low pressure. Pressure difference is high between MR, between chamber in which MR murmur occur. MR murmur take place between LV and LA pressure difference. So pressure difference is more. So it's not low pitch. MR murmur is high pitch murmur. MR murmur is high pitch murmur. So yeah, this is such a basic question, but we need to know the concept. This is quite basic question. Mitral murmur increase in all of the following except. It's not a tough question. It's a matter of just you know the things. You know it's to reaccumulate all the things. Think if squatting occur, squatting compress the femoral artery. Femoral artery compress, systemic vasculature increase. Phenylephrine, vasoconstriction, again systemic vasculature increase. Hand grip exercise, again systemic vasculature increase. If anything which increase systemic vascular resistance, MR or AR murmur will increase. Basic. Right sided murmur increase during inspiration. Left sided murmur increase during expiration. MR murmur is high pitch murmur. It's not the low pitch murmur. Example of low pitch murmur are MS and TS. Answer this question. Something you should know. Something proper auscultation, murmur, conduction, site of murmur is the key in this answer. Soft second heart sound, ejection click, but murmur present over right sternal border and radiating to carotid. It point out murmur at right sternal border radiating to carotid. Murmur present at right carotid border, right sternal border, it's right side. Just a minute. And radiating to carotid, it's a murmur of aortic stenosis. Now you should know about murmur of pulmonary stenosis. It present at left sternal border, second intercostal space and radiating to back. Then it's a murmur of pulmonary stenosis. Murmur on right sternal border radiating to carotid. These are the basic auscultation. When you put a stethoscope, you had a murmur over right sternal border. And if you go up, it's going into carotid. You can feel the thrill in carotid. So radiating to carotid from right sternal border, it's a murmur of AR. If you had a murmur of left sternal border, and if you go, it murmur radiating to back, it's a murmur of pulmonary stenosis. Yes. So these 2 points, by location of the murmur, by radiation of the murmur, We can pick the answer. We can pick the answer. Am I clear? Am I clear? Now, simple. 5-second question. Name the condition. Name the condition. Murmur is here. This is diastolic murmur. This is diastolic murmur. Then diastolic murmur present in mitral stenosis. Another point favoring, this is very easy question. Opening snap present in mitral stenosis. And last one key point, pre-systolic accentuation. You can see here, pre-systolic accentuation present in mitral stenosis murmur. So murmur is not like, once you know the concept, you know the theory, high pitch, low pitch, which is the best point of audibility of murmur, where murmur conducted, systolic, diastolic murmur, names murmur, Astinfluent, Graham Steele, Doc, Gibson, you should know these names. Yes, when we are reading in pediatrics, we are reading neonatology, growth, development, vaccines. Murmur, basic we forget always. In medicine, we learn so many things. Coronary artery disease, stroke, Guillain-Barré syndrome, but murmur, you find question anywhere in the murmur. In any exam, this give you confidence if you read this basic in a free time. So these all are good question of murmur. Answer this question. It's memory based. I have already told you. Doc's murmur is, don't hesitate, put answer. Yes. Doc murmur is murmur of LAD stenosis. LAD stenosis. It's a diastolic murmur. Hypertensive PR, Graham Steele murmur. Complete heart block, right adenous murmur. Rheumatic valvulitis, Gary Coombs murmur. Yes, I love to teach cardiology because I am a pediatric cardiologist. Yeah, my students fond of learning with me auscultation. Yeah, if you learn auscultation properly with the theory, it's a very good art. And we all image like a doctor. Stethoscope, yes, very crazy. When I wear stethoscope first time, even when I reach to the home, I hesitate to take it off. Yes, it's a real golden thing for a doctor, stethoscope. And a stethoscope to hear the sounds, murmur, bronchial breathing, vesicular breathing. So Doc murmur is LAD stenosis. It's a diastolic murmur. So yes, we have done. Now I am coming with INICET 2022 mission. I will complete pediatrics in 10 hours. Key questions, it is for plus subscriber. Don't miss it. 5 session, first neonatology, 2 on basic pediatrics, 2 on systemic pediatrics. Key question, they are not normal question. Those are multiple choices, true, false, like a pattern of INICET. INICET is something tough. Yes, so you find some key question here. Don't miss. Start from tomorrow 9:30 to 11:30 p.m. Yeah, I will take ECG. So I have taken this ECG class, pediatric ECG, my YouTube series. Must know topic. I cover the jaundice, ECG, vaccines, rheumatic fever, seizure disorder, and today cardiac murmur. If you miss this, watch this on YouTube. All are free. You can watch very well. See, this is, I am getting so much appreciation even from my student about the pediatric ECG class. You can see such a nice easy form of ECG. These classes February and March I have taken in the YouTube series. So watch these classes. If any problem next month, okay, just put in the comment box whether you want this series to be continued further in the next month. Must know MCQs. I will choose one topic and cover all the MCQs regarding that topic. Like most know MCQs about pulse, MCQs on pulse, type of pulse, character of pulse, like that. More MCQs on vaccines, like that. If you want, yes, I will take next month. I have taken the whole series of special class intensive revision of pediatrics next month also, but sometime I feel I go with your choice. If you want must know MCQs for certain topic, if you attend this class na, MCQs on jaundice will be clear and you people will guide me na, sir, we want this, we want this, that thing. 30-40 minutes of perfect teaching will help you a lot. That is my purpose, and you all are wonderful learner. So keep reading, keep reading, keep reading. Let's crack it. Myself, Dr. Sanjay Khatri. I enjoy teaching all of you. Thank you. Bye bye. God bless you all. If you like the class, please share with others. Thank you. Bye bye.